Good day. My name is Dr. Hamdan Leman. I am basically a general surgeon initially. Subsequent to that, I have pursued my cardiothoracic surgery field. I was a surgeon in IJN. Subsequent to that, I was also specializing in congenital heart surgery. I spent 10 years with IJN, and then I went to Jeddah, Saudi Arabia, to set up a congenital heart surgery unit there. On my return, I started a program in Sedang Hospital in the congenital heart surgical service also. But currently now I am working with CVSKL for the last 1 year. And I would like to welcome you to this seminar. My topic today is on adult with congenital heart disease, a new epidemics. We all know that congenital heart disease is a problem with the heart structure that exists since birth. And with the anatomical malformation, we know that it will cause physiological derangement, and what it means that it can change the way blood flows through your heart. And it may present as a mild congenital heart disease or serious congenital heart disease. Some congenital heart defects might not cause any problem early on, but some can be life-threatening and complicated. We know when we talk about pediatric or when we talk about congenital heart disease, it mainly talk about pediatric children with congenital heart diseases. And in Malaysia, in worldwide, we have this experience. This is the field that undergone a lot of evolution, undergoing a lot of development, but now it is recognized and it's accredited, and the outcome has improved. And also, even in Malaysia, there are better accessibilities towards this kind of service. But in today's presentation, I am going to talk about another aspect of congenital heart disease, which is adult suffering from congenital heart disease. Why is this increasing incidence of adult with congenital heart disease? Because that some of these congenital heart defect that occurs, they are presenting mildly, and more of the symptoms become more obvious at the later adulthood. And of course, some of these children who had repairs or surgery to their congenital heart diseases, and they survive, and they also present with a different and peculiar problems. So basically, when we talk about congenital heart diseases, some of them is cured, but majority of them is actually just palliated. What it means that it will need to receive care throughout their life. So lifelong expert or specialized care is required to optimize the outcomes. The exact size of the current population with adult congenital heart disease is actually not very well known, but the best available evidence suggests that currently the prevalence of congenital heart disease is about 3,000 per million. And of course, there's regional differences in Europe, in America, in Asia. The variation is because of the different incidence and mortality in each country. But in this presentation, basically I will go through, brings you, the audience, to the historical perspective in the development of congenital heart surgery, understanding the congenital heart diseases and congenital heart surgery, some correlation with Malaysian experience in terms of the congenital heart services, and towards the end I will concentrate or focus on the burden and challenges of children or patients with adult congenital heart diseases. When we look into historical perspective, the understanding of heart was not very well known until we have Leonardo da Vinci in the 15th centuries depicting pictures on what is heart actually is. And the understanding of the heart function is further well described by the finding of, by the discovery of circulation. And we know that the father of circulation is Dr. William Harvey, explaining the function of the heart and the circulation, which he described as circulation in circle. So when we talk about understanding congenital heart diseases, in 17th centuries, a person by the name of Niels Stenson, for doctors we know that Stenson's always related to in parotid ducts. He is a Danish anatomist, but he is credited to be one of those that has accurately described tetralogy of Fallot. He described in 1671 first case of VSD, RVOTO obstruction, right ventricular hypertrophy, and misaligned aorta. And further, maybe in the 18th centuries, Dr. Matthew Bailey has also been credited to be a person who described the presence of transposition of the great arteries. And Dr. Arthur Fallot is very well known for describing congenital heart defects that carries his name. In 1888, described the detail of the 4 anatomical characteristics of tetralogy of Fallot that responsible to have blue baby syndrome. So, if you look at the development of medicine during those days, basically the giant in medicine like Dr. William Osler and Dr. Emmett Hall, in their books, not much is known about congenital heart diseases. So in their books, they will touch only like few pages devoted to the understanding of heart circulation in the early life. What makes it worse, that the giant in general surgery, Dr. Theodore Billroth, he is a great surgeon, but he is known to make this statement that a surgeon who tries to do anything with the heart deserves to lose the esteem of his colleagues. So to him is that operation on the heart is tantamount to an act of surgical frivolity. So all this feeling at that time is that in the late 18th, the congenital heart disease was of limited interest, and it was deemed that at that time this is a disease that is not compatible with life. Of course, in the 20th centuries, development in the understanding of the congenital heart diseases improved. Like, for example, in 1936, Dr. Maud Elizabeth Abbott produced this atlas of congenital cardiac disease, a culmination of her work through thousands of cases of congenital heart disease, either clinical or post-mortem, that he has gone through and put up a very nice illustrated atlas on congenital cardiac defect. So when we understand that there's a congenital cardiac diseases problem that it causes, so what can be done? So the beginning of congenital heart surgery began in 1938. For example, the first person who did surgery on PDA ligation was done in 1938 by a doctor called Robert A. Gross. So he successfully ligated it, and there's a picture where he lives up to be with his patient in 1963. There's a picture there to show reunites with his patient. And subsequent to that, another doctor called Dr. Clarence Crawford successfully repaired a condition called coarctation of aorta, which is a narrowing of the aorta distal to the left subclavian artery. And successfully, this is in 1944, he did it in a 14-year-old boy. And of course, a lot of talk about this figure, Dr. Alfred Blalock, Dr. Helen Taussig, and Dr. Vivian Thomas, in dealing with patients with blue baby, a condition of tetralogy of Fallot, for when there's a problem with blood flowing to the lung. When there's a limited blood flow to the lung, the patient become blue. So what was thought of at that time by Dr. Helen Taussig is to create a shunt, that is the blood flowing from the systemic flow, in this case is the left subclavian artery, and let it connected to the pulmonary artery. With this, there's more flow to the lung and more blood flow, the patient from blue become normal. So this is a procedure called Blalock-Taussig shunt that was performed in 1944 in a 15-month-old girl. And with all this development, the world experiences in congenital heart surgery, if you can see that the repairs that can be done in any form of congenital anomalies is mainly outside the heart. So there are no proper ways of getting into the heart safely to do the repairs until the development or the invention of cardiopulmonary bypass by Dr. Gibbon in 1954. But even though the invention of heart-lung machine at that time, even though in its very raw, crude form, attempts has been made to repair open heart surgery, to do heart surgery, but unfortunately the outcome for this heart surgery has been quite dismal. Many of them died. So there's a doctor called Dr. Walton Lillehei. He is one of those earlier cardiothoracic surgeon that is a genius, whereby because of the problem with the heart-lung machine, so he used the father as the heart-lung machine and doing a cross-circulation procedure. By doing that, he is able to go into the heart and do repairs. For example, from 1954 to 1955, he's done quite a number of intracardiac repair, the VSD repair, TOF repair, with a very commendable outcome using this cross-circulation technique. However, a lot of development has occurred over the time whereby that allows the possibility to repair children with congenital heart diseases, like for example, Dr. Brian Boyes in New Zealand, perfecting the technique of hypothermic circulatory arrest, whereby the baby is cool and the circulation is stopped. That allows the repair in the heart. This is one of those earlier experience whereby the patient is cooled to the body temperature below 20 degrees and stopping the circulation, protecting the brain and the metabolism of other structures, and do the necessary repair. So the surgical strategy basically from 1960 to 1980, the primary repair or the total correction is reserved for bigger babies, for bigger children, for older children. So those who have congenital heart diseases at the younger age group, at the infant age group, so the procedure is either palliative and the procedure is going to be staged. For example, if there's issues with pulmonary blood flow to the lung, systemic or BT shunt or systemic to pulmonary shunt will be used. And when there's an excessive flow to the lung, PA band is done. So basically this is the strategy at that time. But of course, over the time, when advances is seen in the understanding of perinatal cardiac physiology, cardiac anatomy, diagnosis, catheter-based therapy, and the advancement in open heart surgery, things slowly change. The two doctors that took from Dr. Abbott, Dr. Robert Anderson and Dr. Van Pra, husband and wife, they are the one that has been credited to do a lot of research and study of detailed morphology of congenital cardiac disease. This has helped in understanding, imparting the knowledge to the surgeon in terms of how to repair any form of congenital cardiac defect. Of course, the invention of ECG, electrocardiography, and echocardiography, that's has helped a lot in diagnosing a patient with congenital heart disease. Cardiac catheterization has evolved so much since it first attempts on it in 1929, and also of course this in 1956 Dr. Cronin and Richards has received a shared Nobel Prize in terms of cardiac catheterization that has helped a lot in diagnosing and also for intervention. MRI subsequent to that in 1970s give a perfect image on understanding and many forms of congenital heart anomalies. And as reported by this paper, the hospital mortality from 1950 to 1960 has very much improved if compared to the mortality to those who underwent cardiac surgery in 1995 to 2000. These are the figures that has been credited for improving the outcome in congenital heart surgery. For example, the mustard procedure and the sending procedure for condition of transposition of great arteries, even though this is not a perfect repair, physiologic repair, but it has helped a lot of these babies with this condition that is not compatible with life. And of course, in the 1970s and above, treatment for transposition of great arteries. If you understand transposition of great arteries, this is one of the fatal lethal condition of babies who are born with transposition of great arteries. If nothing is done, it is not compatible with life. So Dr. Adib Jatin from Sao Paulo, Brazil, is known as, is very famous to be the person who revolutionized arterial switch operation. Basically, it's an anatomical operation in repairing patient with TGA. And one of the most complex congenital cardiac disease known is hypoplastic left heart syndrome. And even though the baby have this kind of condition, advances in surgery, proponent for it is Dr. Norwood, has produced this Norwood procedure in order to overcome this complex lesion. So there are other development in terms of the presence of nitric oxide to overcome pulmonary hypertension, the understanding of pulmonary hypertension, the development in catheter-based intervention, doing septostomy, and also evolution and specialization of cardiac nursing in pediatric cardiac intensive care has improved a lot in the outcome of children. These are the table or the chart to show in the congenital heart surgery database in US, in Europe, in Japan. Over the years, we can see that there's an increasing number of patient surgery done for congenital heart diseases for children. And if we look at this crowded chart, we can see that cases according to the types, like for VSD repair, tetralogy repair, the mortality rate is very low. For example, for VSD, the mortality rate is only 0.6%, and for arterial it's about 2%. And of course, for the more complex cases like Fontan operation, truncus arterial repair, the mortality is slightly higher. So this has opened up very much into the world of neonatal surgery, meaning that the children who are born with congenital heart diseases will have surgical repair done in order to ensure survival to adulthood. So these are actually a table or charts to show the prevalence of congenital heart diseases. If you look on the one on the blue, is to show that per prevalence of congenital heart disease per 1,000 live birth is around 7 to 8. And it depends whether it is mild lesion or severe lesions. So what I'm trying to show to you that there's an overall increase in prevalence, and of course it's differ from geographic regions. And if you can see the chart on the left side, or the one that written A, overall congenital heart disease, and the one with mild congenital heart disease lesion, you can see that in the Asia region, the number of congenital heart disease is very much higher. If we look at the context of Malaysia, there's a technical report in year 2007. If we take the incidence of children, the incidence of congenital heart diseases per live birth, 8 per 1,000 live birth, and in Malaysia, when we have a birth rate of about 500,000 per year, it is estimated about 4,000 to 5,000 children will be born with congenital heart defect every year, and about 1/3 of these children will require some form of intervention or surgery. So this is we can postulate that there will be around 2,000 to 2,500 children per year that we require some form of intervention or surgery. So if we look at the Malaysian cardiovascular service providers, the one that can deal with congenital cardiac defect is mainly from Institut Jantung Negara. They can do around 1,000 to 1,300 cases. Serdang Hospital, when I was there, we can do about 200 cases per year. Private hospital, 200, so total about 1,700. If we have an annual incidence of congenital heart disease about 2,500 per year, so there will be about 1,000 cases of congenital heart disease do not receive or do not have access to pediatric cardiac center. And on top of that, we know that there are also children that have congenital heart diseases, and children who had congenital heart disease that has been repaired going to adulthood. So we can say that in Malaysia, roughly we have about 30 million population. So roughly we have adult with congenital heart disease for about 1 million. And this is going to be a new epidemics. So actually the problem of adult with congenital heart disease has been made known. People has realized the burdens of adult congenital heart diseases to the healthcare system. Dr. Jane Somerville and Dr. Wood from UK and Dr. Perloff from America is the strong advocate for us to provide some form of specialized service to adult with congenital heart diseases. And this is the paper that I mentioned earlier on, that looking at the prevalence of adult with congenital heart disease. The estimation is that maybe around the region 3,000 per million adults will have some form of adult congenital heart diseases. And if we look at this study or experience, the prevalence of complex congenital heart disease in adults has steadily been increasing. If we look at this chart A, between adults and children, the cases are increasing. But if you look at B, the severe congenital heart diseases for children is plateauing, but in adult is increasing. So basically, when we look whether there's any what is the recommended models of care and organization of care towards giving service to adult with congenital heart diseases. In Western countries, if we look, pediatric cardiology has emerged to be a distinctive discipline in the 1960s. And in the following decades, pediatric cardiology, cardiac surgery has become more formalized and organized. By 1980s, it became obvious that specialized care should be extended into those who have congenital heart disease in the adult life. So we take that those who are above 18 years of age must have some form of follow-up, continued care, specialized care, centers that can provide that. So this is the thing that we are not very well prepared to provide. This is the experience in Montreal Heart Institute in Adult Congenital Center. There's an increasing number as usual. The number of cases with adult congenital heart disease is growing, and they are recommended that for centers to be able to cope, to deal with the rising number of adult congenital heart disease, is to have a proper personnel and resources. Means that, for example, if the center wants to start the program on looking after adult with congenital heart disease, they have to have a cardiologist that specialize in ACHD. They must have a congenital cardiac surgeons. They have to have nurses, paramedics that is trained towards that. So this is in correlation to Malaysian experience. We understand in the Institute Jantung Negara, there is a national program for adult with congenital heart disease, but there are not many in private hospitals that doing this, and Cardiovascular Sentral or CVSKL is trying to strengthen its adult with congenital heart disease program. So what are the most frequent cardiovascular admissions? What are the common issues adult with congenital heart disease will have? Commonly, they will have problem with arrhythmias. Those who have congenital heart disease in the adult period, arrhythmias is the most common issues. They will have palpitation, they have a lot of fainting spells, and the other thing is that they also can present with heart failure, pulmonary hypertension, endocarditis, and those who have congenital heart disease sometimes has issues because when they become the female congenital heart disease patient will have to go through pregnancies. So, for example, arrhythmias is quite common. Arrhythmias mean there's abnormal heart rhythm, and factors leading to arrhythmias is basically when patient had undergone surgery, there will be scarring from the previous incision where the patch is done, the valve is failing, become leaking, and these are all affecting the function of the heart, and this can lead to arrhythmias. And there is a study by Khairi et al. Showing that what are the risk estimate of arrhythmia according to the type of congenital. For example, if you have simple congenital heart disease, for example ASD, VSD, the chances for you to have arrhythmias are not that high. But the more complex congenital heart disease that you are suffering from, the color from light blue become darker, the chances for arrhythmia is becoming higher for complex congenital heart diseases. So congenital cardiac surgeries and interventions are very specialized. For example, when the adult presented with the symptoms or the problem that I mentioned earlier on, some of them can be dealt percutaneously by percutaneous procedures using device, for example, device occluder for septal defect, for abdominal vascular connection, leaking conduits, pseudoaneurysm, or some will use device like covered stents to enhance the safety of, for example, aortic coarctation, conduit stenosis, branch pulmonary stenosis. Some of them will also have to go through cardiovascular surgery to rectify residual or progressive lesions. Whenever there's a patient who had a previous surgery coming back for reparative surgery, and also patient who have not done surgery before coming with some cardiac condition that is failing, palliating non-repairable defects, transplant, concomitant heart-acquired disease. For example, those who have congenital heart disease may also suffer from acquired heart disease. So the complication of surgery is higher because these are reduced and there are also multiple comorbidity. So in short, the adult congenital heart disease is something that needs to be present because there are a lot of challenges now because there are no actual national infrastructures for dealing with adult with congenital heart diseases. For those centers that or institutions that want to start this program, they have to look at the prerequisite of it. They have to have a staff that is experienced, certain equipment, and education and training is also has to be in place. And sadly, those who are having congenital heart disease, usually they are not covered by the insurance, so they are facing issues with affordability to have the surgery. So I'm coming towards the end of the presentation. So in conclusion, dear viewer, the number of adults with congenital heart disease will continue to increase in coming years. I think there must be an effective healthcare policies to accurately to collect demographic epidemic data to plan our resource allocation. There's an urgent need for countries like us to devise and implement sustainable strategies to improve access and outcomes of adults with congenital heart diseases. So there should be more accreditation to programs in institutions, universities or private hospitals, certification of such specialists in the field of adult congenital heart diseases. Education and training has to be carried out. I think maybe it's best to collaborate with regional representatives as part of our strategy to promote and coordinate future advances in the care of adults with congenital heart disease worldwide. So basically, adult with congenital heart disease is a condition that requires lifelong and specialized care. Thank you very much.